Hey responders, it's Brian Fast, Fit Responder, finally coming to you again via the internet. There's been an awful lot of web posts and a heck of a lot of articles. I've been writing a lot for EMS 1, Fire Rescue 1, Officer.com, EMSresponder.com, as well as writing for Livestrong.com. So I've been a busy boy. I apologize for not having some web posts and some video up in a long time, but I thought I needed to address an issue. The issue at hand, as I've been talking to a lot of different agencies, as well as some county commissions and state county commissioners, is the issue of injury prevention versus fitness and wellness. Now, in my personal opinion, they definitely go hand in hand. But what pays the bills and what helps decrease costs from an injury standpoint, from keeping responders, fire, police, and EMS on the street, is injury prevention. And there's a lot of misinformation out there on the best way to prevent injury. There's a lot of new technology with lifting devices and assistive devices, as well as very expensive patient transfer devices, such as the PowerLift cots that are on the market. Now, I'm not here to extol the virtues and or pros and cons of those products. They are expensive, but they do work. However, the data is still very clear. Most injury occurs not because of a particular injury from a piece of equipment, but more so from chronic fatigue. Now, not talking about tired fatigue. I'm talking about physical, mechanical, and muscular fatigue. As I've said, if you've gone to any of my seminars or read any of the articles or the Fit Responder book, is that over time, as our body is constantly exposed to postural distortions and postural traumas, it starts to wear down. You know, you've heard me rant and rave in articles and blog posts that sitting for long periods of time, treating patients in a bent over position, sitting in a patrol car for hours on end, or responding to fire EMS calls is not the most physically advantageous thing we can do. The hip flexors become chronically short and very, very tight, forcing the pelvis to essentially tilt forward. Look at your coworkers, look at your friends. It's nothing but guts and butts. Everybody has the belt hanging over, the belly hanging over the belt. That's what's called lower cross syndrome. What essentially happens is as the hip flexors become tight, it torques the pelvis forward. It actually reverses the normal curve that's supposed to occur in your spine. So essentially, we end up with a hypolordotic or a straight low back. We're supposed to have a slight curve there. It helps distribute load. So as we lose the proper spinal curve in the low back, pelvis is distorted forward, center of gravity gets distorted forward, hip flexors are tight, lower abdominal wall and obliques become very weak, and the lateral hip stabilizers, the piriformis, glute medius, glute minimus, tensor fascia lata, go look at your anatomy books, kids, all become very, very weak. This sets us up for injury. Now this takes time. It's not something that happens overnight. That's why we don't see a lot of injuries statistically as far as disc, low back, chronic low back, and a lot of the nasty sprain strain categories that we tend to see in older public safety employees, because when we're young, our bodies are able to compensate a little bit. However, you look at the curves graphically, and you see a big spike in low back and knee injuries roughly into the, off the top of my head, 32 to 35, maybe a little bit older range. And what happens is that chronic postural fatigue finally sets its evil little claws into our bodies, and we end up getting hurt doing the routine tasks of our job. You ever realize that nobody ever gets hurt on the big call? We're ready for it. We're primed. We're ready for action. Adrenaline's going. We tend to sustain most of our injuries doing simple things like transferring a patient, getting in and out of the ambulance, lifting the cot with, grandma or grandpa who's, 110 pounds soaking wet, because we're not primed for it. The postural fatigue has taken over. The muscles are not working like they're supposed to. They're chronically distorted and chronically weak, and it becomes one of those proverbial straws that broke the camel's back. Now, with that being said, read the articles, read the Fit Responder book. I teach you how to correct these imbalances and these problems. I teach it in my seminars. I wish I could get out there and teach it more. That's what I'm trying to do with this video clip and a lot of the marketing and advertising and articles that I'm doing. But I need your help too, because if the message doesn't get out there, we're going to continue to get hurt. Now, a message about the cots, the power lift cots. Now, I'm not going to pinpoint any companies, because I think the products that are out there are very well engineered, very well designed, and they do what they say they're going to do. They are going to decrease the risk of injury. But I challenge you to look a little bit deeper. A lot of the injuries, matter of fact, most of the lifting injuries that we sustain, especially in EMS, comes about from getting the patient on to the cot. Now remember, unless you're running a call in a hospital or a nursing home, the patient's usually not in bed. Transferring them is not as easy. They're on the floor, they're in a chair, they're in difficult places in small spaces. So unfortunately, a lot of the injury occurs getting the patient to and from that nice expensive cot. Now, I like the cots. I've used them. They work very, very well, and they will decrease the risk of injury. However, it's not enough. Look at the data. It's out there. You know, their EMS, fire, law enforcement is totally 100% unpredictable. You're always going to be in different postural positions. One of the things that I teach, it is something I've taught clinically for years, and it is something that has been proven actually in public safety. There's a great study done out in Arizona a number of years ago with a large urban fire department. They employed some of the techniques that we've been using clinically for years, and they showed substantial decreases in injury just by teaching a couple of simple techniques: abdominal bracing, spine stiffening, and neutral spine. If you can learn, or for this case, when you learn to employ those tactics on the job, your chance of getting injured will decrease over 46%. That's huge. So look at the good data. Well, think about it. You spend the money on one of those new cots, new stair chair, all this nice technology. They're guaranteeing you a certain percentage of injury reduction. Wouldn't it make sense to spend a couple extra bucks to have a program designed to teach abdominal bracing, spine stiffening techniques, and neutral spine, so that and you know, the exercises and stretches that need to be done to combat those postural distortions that will cause tissue failure from fatigue. And now you're looking at, choose what math you want to think about, but I'm thinking off the top of my head close to 80% reduction in injury. The preventable kind. I mean, we're always going to have slip and falls and accidents and combative patients and that kind of stuff. You can't account for that. There's always those intangibles. But if we can take, let's even say 75% of the risk out of our jobs based on technology and engineering and human mechanics, then we have a really, really good thing going. So I challenge you to think about that. Please keep reading the articles. Remember, I love to get out there and speak and lecture and teach these programs, but I need your help as well. Show some of this to your departments, administrators, captains, sergeants, all those good people higher up the chain. Be fit, stay safe, and until next time, we'll see you.